If you are battling high blood pressure, do not be discouraged. Did you know that as many as 72 million people in the US 20 and older have high blood pressure? 28% of these do not even know they have it. Some people do not worry about their blood pressure until they get older. While this might make sense to an extent, it is never too early to monitor your blood pressure. If you have a family history of high blood pressure, you want to start right away. How many people wait until they are diagnosed with something before attempting to prevent it or cure it? Too many. By taking control of your blood pressure today, you can prevent a stroke or developing heart or kidney disease later in life. When you are young, you might be more active than when you get older. Try to stay active, and if you aren't, get active. All it takes is 30 minutes a day of physical activity or exercise to control your blood pressure and better your health. Eat healthy foods. Try to stay away from salty and fatty foods. Salt increases your blood pressure, and fatty foods might cause weight gain, which causes high blood pressure as well. Try to eat more vegetables and fresh fruits. You might find you like more than you thought you would. Stress can cause high blood pressure, but there are so many ways to distress. Do you have a favorite hobby that has no stress? If so, try to do this every time you feel yourself overwhelmed or stressed out. You will be surprised at the wonders it can do. If you take medications, talk with your doctor to make sure they aren't affecting your blood pressure. Certain medications can raise your blood pressure. Antidepressants, cold medicines, oral contraceptives, steroids, even nasal decongestants might be affecting your blood pressure without your knowledge. If you are unsure of your family history, check it out. If you have a family history of high blood pressure, chances are you will end up with high blood pressure as well. If you are aware of this early on, you can start monitoring and controlling your blood pressure before it gets a chance to become high. There are many different kinds of blood pressure medications if you are unable to see results with regular lifestyle changes. Sometimes these medications are needed along with a regular healthy diet and exercise to be more effective. The best thing you can do is talk with your doctor. They can suggest something that will help you control your blood pressure and even prescribe you some medication. If you start medication, be sure you tell them of any other medicine you are taking as well. You want to be in charge of your health and not wait until something happens to take that control. When it comes to your health, you can never be too late, so start as early as you can. You are never alone when it comes to dealing with your blood pressure and other health issues. If you are battling high blood pressure, there are many ways to lower it and prevent yourself from developing it again. The best way to start is without medication if you can help it, by making some lifestyle changes. Do you smoke? If so, this can raise your blood pressure. Try to cut back, if not quit altogether. There are many aids that can help you quit smoking. Do you drink quite a bit of alcohol? This will also raise your blood pressure, so try to cut back to a drink or two a day. Do you consider yourself physically active on a daily basis? Getting at least 30 minutes of exercise a day has been proven to lower and maintain a healthy blood pressure level. Do 10-minute intervals if you cannot set aside 30 minutes all at one time. Start a healthier diet. Did you know salt increases your blood pressure dramatically? Limit your intake of salt or substitute it for other seasonings. There are so many different seasonings available, you should have no trouble finding one you really like. Add plenty of vegetables and fresh fruits into your diet. This will also help lower and control your blood pressure. Try to stay away from fatty foods as well. If you are overweight, this could have a major impact on your blood pressure. Losing as little as 10 pounds can significantly reduce your blood pressure. Once you lose 10 pounds, you will see how easily you can lose more, and you will notice how much better and healthier you feel. Not to mention, your blood pressure levels will decrease. Do you have a stressful job or life? Try to do away with as much stress as you possibly can. If you cannot avoid all the causes of stress in your life, find something that helps you relax and distress. Meditation might work wonders for you. There are certain things you cannot avoid that have an effect on high blood pressure. Your race. African Americans are at a higher risk. If you are older than 55, you are at risk as well, and unfortunately you cannot make yourself younger. If you have a family history with high blood pressure, you want to start early prevention. Knowing about your family history will help in cases like this. Even if you do not have high blood pressure now, you have the risk of eventually developing it, but that doesn't have to happen. Early prevention can keep your blood pressure down. Stay away from drugs and painkillers if possible, as they can cause high blood pressure. Some prescription medications can cause high blood pressure, such as nasal decongestants, anorexia drugs, steroids, antidepressants, oral contraceptives, and cold medicines. If you are taking any of these and are having problems with your blood pressure levels, be sure your doctor is aware you are taking them. Having high blood pressure can put you at a higher risk of stroke and heart and kidney disease, so preventing this can benefit your health immensely. Talk with your doctor of any questions you might have or concerns. No question is silly, and it is never too early to start taking better care of your health, starting with your blood pressure.